Hey everyone, so this is my case study for psychopharmacology class. The co-occurring disorders that I chose to use are alcohol use disorder and borderline personality disorder. The case study that I have invented is the case of Christina. Christina is an unmarried 27-year-old female. She has never been married and she has no children. She was raised by her biological mother and her stepfather, and she has two younger step-siblings. Her biological father has never been involved in her life. Her mother ended up never being in a relationship with that man, and so she has never met her biological father, nor does she really know who he is. Christina's stepfather physically abused Christina's mother. He hit her several times, usually when he was drinking or when they were both drinking. He drank excessive alcohol and he was verbally cruel towards Christina. He called her fat, lazy, stupid, and essentially just was not present really for her as a father. Her mom divorced the stepfather when Christina was in her 20s, in her early 20s. Christina is still close with her mom and her younger stepsister, but not as close with her younger stepbrother because he is struggling with drugs and alcohol and they don't always know where he is, and it's just difficult to maintain a relationship with him because of his struggles. Currently, she works full-time as a bank teller and she is in a relationship with Josh. He is divorced and he's around her age, a little bit older, and he has two children from his previous marriage. He does not have full or 50-50 custody of his kids. He has them on the weekends and 1 month in the summer. And Christina has never met his children. He is waiting to introduce his children to a girlfriend when that girlfriend becomes a very significant part of his life, to the point where he's considering marriage, and Christina is fine with that. So kind of the presenting issues here. She has a history of a lot of different jobs. Each job has lasted 2 years or less. She reports that at each of those jobs she got to the point where she was pushed beyond her limits. She describes her previous supervisors and coworkers as stupid, that she's smarter than they are, and she ends up, as she puts it, rage quitting jobs quite suddenly. She ends up yelling, swearing, and basically sometimes even being escorted off the premises to come back and get her things later. She has a history of unstable interpersonal relationships with friends and romantic partners. She's had a couple falling outs with her mom as well. She reports ending relationships because before the other person can end it first. So that is romantic relationships as well as friendships. She tends to push people away. She tends to feel intense love or intense hate for someone without much stability in between. She reports feeling empty inside, isn't sure she really knows who she is or if anyone could really love her, the true her. She reports that she drinks daily. She has drank daily for several years. She doesn't drink to excess every time that she drinks, but once or twice a week she gets pretty bombed and sometimes doesn't remember what she did the night before, doesn't remember texts that she sent, so there's some almost like blacking out that's happened. So recently, what brings her to counseling is that she had threatened suicide after an argument with Josh while she was intoxicated, and he called 911, as he should have. And she reluctantly went to the hospital. She was held for 2 days at the hospital, and the hospitalist psychiatrist didn't offer any diagnoses. Kind of was more of a detox situation. He didn't offer any diagnoses, and then he referred her to a psych NP for follow-up, and then also me as a counselor. Josh said he is tired of the dramatic fights and says he's going to end the relationship if she doesn't get help. So borderline, as we remember from our DSM, pervasive pattern of instability of interpersonal relationships. I'm not going to read all of this because we all took this class, but some of the hallmark symptoms are that there are like disturbances of affect, impulsivity can happen, the unstable and intense Relationships, as I mentioned, recurrent suicidal or self-harming threats, gestures, or behaviors. So people can cut, they may threaten suicide, and it's fairly impulsive. Lability in mood or anxiety, chronic feelings of emptiness. Sometimes people with borderline, the people who know them will say, I never really know who she is. She seems to, when she's with this person, she's like this, and when she's with me, she's like this, and when she's with her mom, she's like this. So it's almost like a kind of an instability of identity that can happen. Intense anger that's difficult to control, and even some paranoia or dissociation. So alcohol intoxication and alcohol use disorder, signs that mimic the symptoms of borderline personality can be that impulsivity, impaired judgment, blackouts, so impairment in memory, inability to remember events despite being fully awake and conscious, impairments in social, interpersonal, and occupational functioning, difficulty regulating emotions. So you can see why there is kind of a mix there. When both things are happening at the same time, it can be kind of difficult to differentiate. So it's common for individuals with alcohol use disorder to present with borderline symptoms, and people with BPD are more likely to use maladaptive coping mechanisms, which could include alcohol use or drug use. Of individuals who seek treatment for substance use disorders in general, borderline personality disorder is up to 65% of those people. So you can see here that when the disorders co-occur, people with BPD consume alcohol at a faster rate to increase positive and decrease negative feelings. And there's higher rates of self-harm and suicidal behaviors and risky behaviors. So strategies, DBT is the gold standard, but there are other therapies that can be used. Dual focus schema therapy, dynamic deconstructive therapy. I don't know much about those, but they exist. And then psychoeducation about the disorder to teach the person the signs and really the best ways to cope. And you can't really be diagnosing BPD until a person is sober for a little while, so you can tell the difference. And then there are also some medications to use if the person has a co-occurring mental health disorder, and medications for alcohol addiction. And here are my sources. Thank you for watching.